everybody. Today we're going to be talking about safe medication handling and how to properly dispose of medications. Our objectives today are to go over some very basic medication administration rules. That's going to be understanding the 3 checks prior to your medication administration, understanding and reviewing the 6 rights of medication administration, and how to destroy medications properly. Each time you give a medication, you also need to remember to do the 3 checks. This means you're going to do a triple check to make sure that the 6 rights are present each time you give a medication. The first check is to remove the medication from the locked area and check the prescription label against the EMR to make sure that they match. The second check is before you pour out the medication or pop the bubble, check the prescription label against the medication order to make sure that they match. And your third check in your triple check set, after you pour out the medication, but before you give it to the resident, check the label again to make sure that the label in the EMR entries match. Now we're going to take some time to review the 6 rights of medication administration. For many nurses, this happens without even consciously thinking about it. The 6 rights of medication administration are the right individual, the right medication, the right dose, the right time, the right route, and the right documentation. The right individual. Even when you know the individual well, mistakes can still happen. Sometimes when medications are being administered to more than one individual in a group or communal setting, or if you're preparing the medications for one or more individual at a time, you can become distracted and accidentally give the medication to the wrong person. You can avoid a serious mistake if you prepare the medication for one individual at a time. You give the medication to the individual as soon as you prepare it. Don't prepare medications ahead of time. Do not talk to others and ask them not to talk to you when you're preparing and distributing medication. Do not stop in the middle of a medication administration to do something else. Pay close attention at all times when you're giving the medications. The right medication. In order to be sure that you are giving the correct medication, you must read the medication label correctly. Remember that most medications have more than one name, a brand name, and at least one generic name. Check the spelling of the medication carefully. If there is any doubt whether the medication name is correct, stop what you're doing and call the pharmacist before you give the medication to your patient. These 2 medications are spelled very similarly, but have 2 very different actions, and it's easy to see how a mistake could happen very quickly. Read the medication order carefully. Make sure that the medication name on the order matches the medication name on the label, and read through the EMR carefully. Make sure that the medication name on the label and the medication order and the EMR all match before you give the medication. Look at the medication. If there is anything different about the size, the shape, or the color of the medication, call the pharmacist before you give it. It could be that you have been giving a generic brand of the medication, but sometimes when a medication looks differently, it might mean that you have the wrong medication. Did you know all medications coming from our pharmacy have a description on the back of the card telling you exactly what the medication is supposed to look like? On this example, it says that the tablet should be white, round, and have the letters AC and the numbers 42 imprinted on the tablet. In the picture on the right, you can see the letters AC and the numbers 42 on the tablet, confirming you in fact have what the card is supposed to have in it. This is super handy. I've been a nurse here for 13 years and I didn't realize this until today. The right dose. To determine the dose, you need to know the strength of each medication. In the case of liquid medications, you need to know the strength of the medication in each liquid measure. The dose equals the strength of the medication multiplied by the amount. The dose is printed on the medication card and the EMR. Here's an example of the same order written two different ways. Lasix 20 milligram tablet, give 3 tablets POQ day. In order to find the right dose, the strength of each pill is 20 milligrams. The dose is 3 tablets. We know simply 20 milligrams per pill times 3 tablets equals the correct dose, 60 milligrams. The other way this order could be written is Lasix 20 milligram tablet, gives 60 milligrams POQ day. The dose is 60 milligrams. The dose strength is 20 milligram per pill. The total dose is divided by milligram per pill. We know that it comes out to 3 tablets. The same order can be written multiple different ways. So it's very important when we get into mixing and having multiple tabs or give 1.5 tablets. This order could also say give, Lasix 10 milligrams, give 6 tablets, which is a little silly, but it could happen. So there are many ways to write each order. We know that, but knowing the dose and how it can be different is very important. The right time. Some medications must be administered only at very specific times of the day. For other medications, that time of the day when you give the medication is less critical. We know, for example, that some medications must be given before meals or 1 hour after meals or at bedtime or sit up for 30 minutes after you've taken it but before you eat. It's very important for medications to be given at the time of the day that the order is written. If no specific time is written on the medication order, ask the doctor or pharmacist about the best time of day to give the medication. As a nurse, we know that the best time of day to give certain medications can really make a difference. We give thyroid medicine very early in the morning prior to any other medications. We give PPI inhibitors prior to meals. We know that those are the best times of days for those types of medications. Medications must be given within 1 hour of the time that is listed on the EMR. This means you have 1 hour before the medication is due and 1 hour after it is due to successfully administer the medication in order to be on time with the medication administration. The 1 hour time frame does not apply to PRN or as needed medications. For example, if you have a PRN medication order and a PRN protocol for Tylenol to be given every 4 hours as needed, you cannot give it until the 4 hours have passed since the last dose. You cannot give this dose 3 hours prior. The right route. The route means how and where the medication goes into the body. Most medication is taken through the mouth and swallowed, but others enter the body through skin, rectum, vagina, eyes, ears, nose, and lungs, or through a G-tube or by injection. The most common way or route for medications to enter the body is by mouth or PO. Documentation. Your responsibilities are not done yet just because you have successfully administered the medication. Each time a medication is administered, it must be documented. Your documentation of medication administration must be done at the time you give the medication. You must complete all of the documentation that is required. Review your MAR at the end of the shift to make sure all medication has been given. If you have any doubt about whether you are giving the medication correctly, please ask. If you make a mistake, follow the policy for reporting medication errors. Medication errors happen to everyone. It is nothing to be ashamed of, and it is a great opportunity for someone to learn. Now we're going to switch gears a little bit after our review and talk about controlled substances and our policies and procedures as it relates to them. Narcotic counts need to be completed anytime you are handing off your keys in a change of shift. If you have staff who are coming on from 2:30 to 5 and then somebody else is coming in at 5, each of those people need to count. Anybody who's going to take ownership of the keys needs to count to know what is in that cart to be accountable for. You are responsible for what you're signing. Narcotics must be under a double lock at all times. This means the locked med room or the med cart and the locked drawer. Keys should never be left on top of the med cart. By leaving the keys on top of the med cart, you've successfully removed one of the double lock situations. Card integrity. Recently, we know that some card integrity has been questioned. We want to make sure that we're checking the integrity of the cards that we're accepting from the pharmacy. Check the card prior to accepting and signing off from the pharmacy. I know you're very busy when the pharmacy comes to deliver, but it's important to take a glance at the meds that you're taking to make sure they're correct. If a card is damaged or open in any way, return it to the pharmacy. If a card becomes damaged, do not place tape over the opening. The only acceptable replacement covering is if the pharmacy completes it like below. If you discover on your shift that a medication card's integrity is no longer intact, report it to your supervisor. Do not attempt to repair the card yourself with tape. Wasting medication. Wasting medications is always a two-person job. One licensed staff. The second person does not have to be licensed, but does have to have a reasonable accountability. Both people need to be present and see the medication that is being disposed of in the drug buster. The second person should confirm that the medication is actually what is being disposed. One person should never waste medication on their own and then have someone just sign off on it. If you open a resident's medication and only remove a half or partial dose, waste the rest. Do not reseal it to try to save money or anything like that. It needs to be wasted, and to do that, you'll need a second person. If you have any questions or need more information on safe medication handling and administration, medication disposal, or proper narcotic handling, please let myself or Mallory know, and we'll get you the answers that you need as soon as possible. Please complete the attached quiz and return to Mallory or Emily as soon as possible. Thank you. Have a great day, guys.